As the innovation arm of the NHS, England's 15 academic health science networks are playing an important role in supporting our national and regional health systems to respond to these unprecedented times. AHSNs work across the NHS, social care, public health, research, the third sector and, crucially, industry. This helicopter view means we have been able to support rapid identification and spread of proven technologies that can help both with the current response and the ongoing reset of healthcare services. The acceleration of the pace of innovation adoption over the past 4 months, particularly remote and virtual technology, has been staggering. Patients and healthcare professionals have quickly adapted to new technologies. Initiatives that were taking months or even years to progress are now being rolled out within a matter of weeks and days. Just a few months ago, this would have been unthinkable. The close collaboration between industry and healthcare has been critical to the COVID response. Both have got on with the tasks at hand. Can this collaboration set a new paradigm, or will we see less positive consequences as the NHS grapples with the financial impact of COVID? It is critical that the voice of industry is at the heart of discussions around the reset of our healthcare system. With this in mind, on behalf of the Academic Health Science Networks, I am delighted to be co-hosting this important innovation roundtable.
Depending on speciality, COVID-19 has had markedly different impacts on the medical device, diagnostics and digital healthcare industry. Companies focused on elective care have seen sales reduced to a trickle virtually overnight, while those in the critical care sector have seen dramatic increases in demand. Virtual clinics, remote monitoring and online triage have demonstrated that the NHS can rapidly implement new technologies and ways of working. We need to lock in these positive benefits and seize the opportunity to re-engineer how the NHS works with industry, to bring about change for the NHS and patients. That means the ability to rapidly identify, assess, reimburse and procure technological, clinical and system innovation. However, simultaneously, we've seen the NHS and government machinery unable to cope with the variety and quantity of offers of help to tackle the pandemic, with opportunities being missed and vital supplies being redirected to other jurisdictions. As the elective care restart gains momentum, there are significant variations in response, capacity and capability. A lack of system transparency makes it impossible for companies to accurately plan inventory, putting continuity of supply of critical products at risk. A renewed relationship between NHS and industry, born out of our shared experiences of COVID-19, should help us build on these learnings to ensure that the UK has the necessary diagnostics capability and that supply chain resilience becomes an important factor in a value-based approach.
The NHS has been under phenomenal pressure because of this coronavirus, and everybody working in it has really stepped up. Our companies have been doing everything they can to help in the pandemic response too. From sending medically qualified volunteers back to the NHS frontline, donating clinical expertise, to helping deliver medicines to the most vulnerable people. For us, the most challenging aspect of COVID has been the fact that so many important services for patients have been put on hold. This is understandable, but we need to work out how we can start them up again in a safe way. Thankfully, some patients were able to continue treatment and some clinical trials ran throughout COVID-19. This could happen because new and innovative ways of working were put in place, such as monitoring patients remotely and allowing clinical trial medicines to be delivered to people's homes rather than to hospitals. The tough learning curve that this virus has given us has also provided real opportunities to develop new ways of caring for patients and embedding innovation so that the NHS can provide great care for all patients in all areas, whilst at the same time increasing resilience in the system.
Age is no barrier. Older people have embraced online health services and have adjusted very quickly. For example, Echo Pharmacy recorded a 60% plus increase in the proportion of people over 65 using their service in just one day on the 15th of March, and it's been sustained. The attitude change the lockdown had enforced from "I need an appointment" to "I have a health issue that needs fixing" transforms the patient experience, saving resources and improving patient and GP outcomes massively. Online services have seen big increases. Some pharmacies report 20-fold or so increases in demand during the lockdown and seem to have coped well. GPs have accepted that mobile devices really can do things that couldn't easily be done before, like taking a time series of vital signs such as weight or blood pressure. Plus they can send photos in to avoid the need for face-to-face consultation. Ingenuity has known no bounds. There have been many innovative uses of online technology that have come to the fore, including speech analysis to diagnose COPD with the microphone as a spirometer, cough analysis to estimate likelihood of COVID-19 infection, and playing tones of different frequency on a device held in the hand to determine the resonant frequencies of the lower arm as an indicator of osteoporosis. So to summarise, I reckon patients won't give up most of the ground that has been conceded, and nor will GPs who are truly interested in patient welfare.
The British In Vitro Diagnostics Association, or BIVDA, represents more than 100 companies supplying diagnostic tests and equipment to the NHS. During the COVID-19 pandemic, the in vitro diagnostic industry has been able to demonstrate the speed in which it can innovate, rapidly making the first diagnostic tests available for a previously non-existent infection. Normally, widespread adoption of a new test by the NHS can take up to 10 years, but this crisis has shown it can be done safely and rapidly, if required. I'm optimistic that this will change the way we evaluate and introduce innovation in the future. Meanwhile, we've all been made aware by doctors across the NHS that the number of non-COVID presentations have dropped dramatically, and our own members are telling BIVDA that the demand for what is normally essential diagnostic testing has reduced by up to 70%. Crucially, this also means a huge number of people with undiagnosed health issues may now have worse outcomes. For example, 90% of bowel cancer patients will not survive if diagnosed at stage 4. Whereas picked up early following a FIT test or a positive calprotectin test, and the mortality rate reduces to 10%. The cost of treatment to the NHS is also reduced by similar percentages. We need to get normal testing resumed urgently before the winter, when the usual burden of respiratory disease may also be exacerbated by resurgence of COVID-19.
AHSN adapted quickly to new NHS needs as the pandemic took hold. Drawing on experience and strong networks, AHSN supported innovators to hear and understand priority needs, to access funding and procurement routes both locally and nationally, and to achieve adoption as part of national change. As the wider health system begins to reset, there are unknowns. These include the consequences of prolonged service reduction, prioritisation of actions to address these consequences, and finance available to support these priorities. To reset in a timely and effective way through pre-pandemic ways of working is unrealistic. Dialogue between the health and life science sector and the health and care system will be essential to reset patient services that are safe, resilient and high quality. AHSNs will continue to bridge the gap that helps industry to help the NHS and those they serve.
Technology has played a major part in the response to coronavirus right across the world, and our country is no exception. The tech response has been nothing short of extraordinary. We've had Openreach vans delivering donated Facebook portals to care homes to connect shielding residents with their loved ones, internet service providers ramping up the bandwidth, of clinicians reviewing patients and images from home, and a British startup enabling people hospitalised with COVID-19 to return home earlier, monitoring their care with an app and a pulse oximeter, letting clinicians review their recovery. These all happened incredibly quickly and without any cost to the NHS as part of these companies' response to the greatest challenge the NHS has ever faced. At NHSX, we have been inundated with offers from technology companies and also been gifted staff from across Whitehall and from organisations as diverse as the CQC and the Royal Albert Hall. A huge thank you to AHSNs who joined a blended team providing boots on the ground to enable the digital primary care changes to happen so rapidly. We couldn't have done it without you. But perhaps most importantly, we have seen a mindshift change, both in the public and in the NHS, with digital solutions being embraced like never before across health and care. It would be amazing if we could hold on to this mindshift change and see what we could deliver in the future. I think we can do that together, with your help.
Coronavirus has had a terrible impact that I'm sure none of us will ever forget. We must also learn from our response to the pandemic and recognise that we've seen some really positive changes and work to improve and embed these. First, for research. We've seen research happen much more quickly, with world-leading trials, such as the recovery trial in Oxford, being set up, run and reported in astonishingly quick time, meaning clinicians have faster access to evidence about life-saving treatments for patients with coronavirus. Second, for adoption of innovation. We've seen the rollout in record time of digital tools, such as remote consultation software to support GPs to continue to provide care to patients safely. This work, led by NHSX, working with the Accelerated Access Collaborative and the Academic Health Science Network, led to 99% of GP practices having remote consultation software in just a few weeks. Third, we've seen some outstanding partnership working, with successful collaboration across the NHS at national, regional and local level on digital tools, between industry itself, including AstraZeneca and GSK supporting a new testing laboratory at Cambridge University. And we've seen genuine partnership working between NHS and industry, particularly the support industry has given around diagnostics for COVID, providing skills, expertise and people to support the rapid expansion of COVID testing. We will now look closely at these lessons together and determine what's worked best and what must be embedded into the way that we do things.
I firmly believe that we have the best life sciences industry in the world. Reset provides us with an incredible opportunity to take stock of the lessons from the pandemic. As national leaders, we have a responsibility to surface and address the challenges that industry has faced, and also seek to lock in the positive benefits of culture change that has enabled rapid technology adoption. The Academic Health Science Networks will continue to support these conversations. We are committed to aligning our future support to help bridge the gap between commercial innovators and the health and care systems that we so desperately need to support. Articulating system needs, supporting with validation, brokering connections between sectors involving patients and innovation co-production, and enabling more rapid scaling up of technologies are just some of the issues we are keen to discuss. On this note, I would like to thank our roundtable partners for their thought-provoking introductory insights so far, and I'm looking forward to opening up our discussion.